Hi everyone, it's board certified plastic surgeon Sean Doherty from Boston. I'm talking today about rippling and palpability for implants. Well, what is that? It's really noticeability of an implant, and it's not something that anyone wants. So what are ways to have that not happen? Well, it's first of all to avoid that to start with, and that's really proper implant selection. So implants that are more associated with rippling and palpability are saline implants, implants that are placed above the pectoralis muscle, and implants that are probably too big for one's body. So we like to cover an implant with as much of your own natural tissue as possible, that is skin, fat, and breast tissue. So thinner patients tend to have very little excess fatty tissue and glandular tissue, so putting in an extremely large implant is going to make that very obvious, and one is going to be more aware of that, again, rippling and palpability, and that tends to happen on the lower pole here. Silicone gel implants tend to be less bothersome when it comes to rippling and palpability, as they are more smooth, cohesive, and just in general more satisfying than saline implants. So it really starts with a good consultation with a plastic surgeon that assesses your anatomy and comes up with the best, safest options. Now, if someone does have rippling and palpability, what are good ways to address this? Well, if an implant is placed above the pectoralis muscle, one can change that pocket, and sometimes that can help improve the rippling and palpability. Switching a saline implant to a silicone gel implant can help. And also fat grafting. So oftentimes rippling and palpability is noticeable because a patient doesn't have a lot of fat to their breast. So putting fat above the implant underneath the skin can smooth out contours. So I hope this was helpful to you. If you have any questions about rippling or palpability, reach out to me, read my blog, and talk to you soon. Thanks. Bye-bye.